Welcome to another product overview. This one is going to be about the Chattanooga Intellect Focused Shockwave unit. It's part of our shockwave family that delivers an acoustic wave pattern into the tissue. So let's take a little bit closer look. So Focused Shockwave, as I mentioned, is part of the shockwave family. So it delivers an acoustic wave into the tissue to do some things, whatever it is that we're trying to accomplish. Also known as extracorporeal shockwave therapy, or ESWT. I am Chris Prue. I'm a director of clinical education for Chattanooga. I'm also in private practice, so I get the pleasure of actually using this equipment in clinical practice. So hopefully I'll be able to give you some insight as to where you may see a benefit of using this particular therapy. So this is a form of shockwave. So shockwave is not something that's new. We find it in nature. It's also man-made. Typically, it's a result of generating a really high pressure that results in a negative pressure. How do we do that? Well, we're going to be using a very special system that we'll see has a long history, even in another area of medicine. But to accomplish that, it means that you have to deliver a relatively high pressure very, very rapidly. So that way we can go past sort of the normal physiological elastic function, supportive function of the tissue, and then springs back and then goes into a negative pattern. So as you can see here, we do see them as a result of lightning storms or, passing the sound barrier, right? Going past the speed of sound, creating a sonic boom. My favorite one in the lower left-hand corner there is a pistol shrimp that creates a very, very quick rapid snap underwater to develop a shock wave. And then of course we can see that from explosions. So we're going to talk about, what it is that we're treating, why we're treating it, look at a little bit of background of shock wave, the biological effects. How does this guy actually produce that amount of energy? And then what does it do? So the tissue matrix disruption model, and then quickly go over an application technique, and then a little bit about the device, some of the features that you might see on this particular unit. All right, so historically, this guy, this focused shockwave unit, which is the sort of the big brother to this guy right here, which is a radio pressure shockwave unit, radio pressure wave unit, or extracorporeal pulsed activation technology unit. So this one is really the direct lineage of lithotripsy. So lithotripsy is a form of acoustic energy that's delivered specifically with the goal of disintegrating kidney stones, right? So it's done under imaging, it's done in a hospital setting by a physician because its goal is to generate a large amount of energy to make its way into the tissue where it's going to be destructive. So the lithotripsy extracorporeal shockwave devices are a little bit different in that they deliver a lot more power. So upwards of 6 millijoules per millimeter squared. Even if you don't know what that is, let's look at, well, what does this guy deliver? So this unit in particular delivers a maximum amount of energy at 0.55 millijoules per millimeter squared, right? So in comparison, lithotripsy, 6.0, extracorporeal shockwave in the therapy world, 0.55 millijoules per millimeter squared. So significantly a lower amount of energy. And in fact, we are not attempting to be destructive with this. We are trying to accomplish something known as a pressure wave interpretation at the cellular level to do whatever it is that we think we want to do with it, which we'll come to in a moment. So in comparison, both of these devices do start their life as an acoustic wave pattern. The production of the energy is a little bit different. We can also see the delivery is going to be a little bit different. So the applicators are different. And as a result of this guy being this electromagnetic system in a cylindrical coil applicator, develops a very, very high pressure over a very, very short period of time. Right? But we'll look at the applicator head here in a moment, and the way that it creates its energy. And like a lithotripsy device, it generates a lot of its energy across a large surface area to deliver it through the patient to a target tissue where it actually all accumulates. That's the reason that you don't feel it on the superficial areas of the body, such as the skin. That's also why it doesn't create any impact on that tissue until it really starts to get close to where that target area is going to be. So it creates a very high pressure system, and then it goes down into the low pressure system. So that's kind of the main reason of what it's doing when we look at what it's about to do here in a moment. But also we don't have full explanation as to, maybe why it's doing all of this. At the cellular level, we have a pretty good idea, but, the overall outcomes are, maybe just still a little bit of a mystery to us as to why this is occurring. Also, in comparison, when we look at the focused shockwave actually has a converging pattern, whereas the radial actually has a diverging pattern. And that's another reason why, it's a much broader surface area that we're being treated with the radio pressure wave. And also the energy is greatest at the applicator tip itself with radio pressure wave, and why it dissipates as it gets into the tissue. And then with focused shockwave, the greatest energy is actually at the target, which is approximately about 5 centimeters when we're not using any of these standoffs. So again, to give you a sense of this energy expression, low is up to 0.09 millijoules per millimeter squared. So this device actually starts at 0.01, and then we've got medium, and then we've got high. Now, again, this is relative to what we're using in the therapeutic market. So high is specific to our devices, because high in lithotripsy, well, it would be much, much higher than 0.06. It would actually be, 0.6. It would actually be 6.0, right? So lithotripsy is much higher. So these energy expressions, energy flux densities are very specific to the devices that we're discussing here. So this guy has actually really shined historically in the recalcitrant conditions, chronic conditions, because the intent really was, the idea at least, was to create a high pressure to disrupt the tissue matrix, right? To create an insult to the tissue in an area that has otherwise been considered stagnant for a period of time. So we look at the classic indications, and they're the apathies, the itises, which should be apathies, but so things that the patient's been experiencing for an extended period of time. But we have seen the literature develop over the last several years. And so one of the things, even though we don't know exactly why everything is happening, we do know that the pressure receptors on the outside of the cell and the pressure receptors on certain organelles inside of the cell do not need high amounts of pressure, but pressure in and of itself seems to be generating some of these physiological outcomes that are occurring. Basically, the earlier indications really stem from the similar reasons that you were doing some of your other soft tissue mobilization techniques like cross-friction massage and other forms of ISTIM, right? So we were trying to create a tissue matrix disruption. Actually, we used to think that we were kind of breaking down scar tissue, but in fact, we know that not to be true today. So the terminology we use is a tissue matrix disruption, because the idea is that we're actually just insulting the tissue to reinvigorate a process by which we're going to initiate healing again for something that, well, doesn't seem to have been working for a while. That's good news, because we're dealing with these recalcitrant conditions that may be causing some, further complications to pain or movement dysfunction. So we look at the historical perspective of how this, sort of came about. So back in the 1980s, late 70s, in fact, when lithotripsy was developed, obviously not rudimentary back then, but looking at the electrohydraulic source compared to today's electromagnetic source or cylindrical coil is a much more efficient way to develop and deliver the energy from the applicator into the patient. So we can see that we've gone through, several generations of different types of applicators, and why, some of the others, piezoelectric, electromagnetic source with a flat coil, are still around today, and they're considered not to be as powerful of generators and compared to what we have. Okay, so this is the applicator, kind of looking at it close up, so you can actually see the parabolic nature of this to some extent right there, right? And then you can see that cylindrical applicator coil in the middle there, right? So if you press on that, right, actually feels like a membrane. Well, it's filled with water, right? So the unit here generates a very, very high voltage electromagnetic field that is used to generate this energy that releases this acoustic wave, right? So it comes from all these different points along the applicator to deliver that into the patient, right? And then there's going to be a target of all of that energy accumulation about 5 centimeters or so past the applicator itself. So you can kind of take that into consideration when you're delivering this energy into the patients and thinking about your overall depth of penetration that you want to deliver it to. Okay, so what does it do exactly? Well, like I said, some of it's still a little bit foggy for us in terms of why some of the things are happening. But basically, as we introduce the energy, which is acoustic to begin with, but once it starts to hit the tissue and actually literally move tissue and be sensed by mechanoreceptors, through mechanotransduction, that energy now becomes mechanical in nature. So that wave pattern, as it translates through the tissue, that pressure pattern is now moving through the tissue in a mechanical nature. Well, that pressure stimulation to the receptors, the pressure receptors on the cell structures, then give us these biological responses, such as the release of endothelial nitric oxide, vascular endothelial growth factor. So a bunch of chemical mediators that then give us the physiological response. And so overall, what we tend to see is this decrease in pain because of stimulation to nerve endings and even other mechanoreceptors that also facilitate a reduction in pain, like Meissner's corpuscles, for example, due to the energy stimulating those receptors and making their way up to the cortex and suppressing pain, reducing inflammation as a result of some of the compartmental pressure differential changes and the influence and increases in microcirculation, but also some of the physiology that's occurring. So it also instigates the release of, substance P, reducing bradykinin. So the physiological parameters associated with the inflammatory cycle, also increasing influence to the nucleus, so transcription translation that results in increase in fibroblastic activity or the rebuilding and addition of some of those new tissues, including cell differentiation. And we see that in that tissue proliferation stage. So essentially, at the end of the day, what we're trying to accomplish is a reinstigation of something that's stalled, or if we are treating something a little bit more on the non-chronic side, is improving the overall recovery and eventually instigating a new healing aspect. So the application is about the same or a little bit less than ultrasound, right? So ultrasound applications typically range between 7 and 13, 14 minutes if you're doing vigorous deep heating. So these will take approximately between 3 and 6 minutes for most applications, maybe a little bit longer if you're treating a very large area that requires multiple points to it. There tends to be some minor discomfort with the treatment because if you are using a high energy and you're treating something chronic and you're trying to insult the tissue, well, an insult is sometimes uncomfortable, right? And so there may be a little bit of discomfort to the patient, but we tell them that up front, and usually the end result supersedes any notion that they wouldn't want to go through a little bit of discomfort during that treatment. We do not use any analgesics or anesthesia as a requirement, but you could use it in application with some of your other topical agents, either before or after, or in combination with some of your other treatment approaches. The number of treatments is usually somewhere between 3 and 5 for the majority of the things that we're actually going to be treating. And we do that about once per week. Right? So over the course of 3 to 5 weeks, we're going to deliver this once a week, and that's about it, so it's going to take about, like I said, 3 to 6 minutes for the most part for most treatments once a week to accomplish that. Now, we don't just do this, it's in conjunction with the other things, the other therapies that you're actually doing with the patients. Now, expectation after being treated, it's not unusual that people actually experience a little bit low amount of pain, less pain, and sometimes improvements in things like range of motion and even strength, endurance, or movement patterns. So those are things to take into consideration after treating. And the nice thing with that is patients see that pretty quickly. So the parameters that we're going to be looking at are: what's your intensity, the number of impulses, and the frequency. And the frequency meaning the frequency at which the impulses are being released from the applicator. So in hertz, the number of pulses or shocks per second. And again, we do that about once a week, once every 5 to 7 days. Most people if you're running that five-day a week schedule, then that usually translates into about once a week for most conditions, especially if they're the chronic conditions and you're being, somewhat aggressive. Total number of treatments typically range between 3 and 6 to get to a point where we probably don't need to be applying this anymore. If it is a low energy density, maybe you're treating and you're using this for a more acute condition, or the sensitivity, the threshold is just very, very low. It allows us to actually deliver it probably a little bit more frequently, and we might be able to get away with 2 times per week. So some of the features when we look at this particular unit are, it has a cylindrical coil applicator. Well, why does that matter? Well, that's the latest technology. So that assures you that you're delivering the optimal energy dosage into the patient. And it has a little something to do with the value. So you're getting the most latest technology with delivery of this particular application. And if you even look at some of the literature in the future where this has been utilized, it's pretty amazing. How do we control the depth of penetration? We control it really with the standoff. So you can see these 2 attachments, and we'll break to a video here in a second, but you can see how we have these different attachments, either directly with the applicator directly on the surface of the patient, or a medium or a larger standoff to bring it further away from the surface of the patient, which is also going to bring the target back. The depth of penetration is pretty amazing. So it goes down to 12.5 centimeters as far as its physiological influence, which is pretty much all that we're going to need, much, much greater than every other physical agent that we have on the market, but certainly deep enough to probably get to most conditions that we actually need to deal with. There's a software interface, so it uses a touchscreen interface that allows us to set the desired settings, as well as any of the configurations and changes that we need to the device. And we have the ability to save some custom protocols. It is embedded with one protocol, the plantar fasciitis protocol, but you can set up your own custom protocols, save them, recall them. The machine will actually just load them automatically and allow us to save a little bit of time when we are getting ready to treat a patient. So application is pretty simple. So the parameters on the screen right here is just the energy, the shocks, which is the number of impulses and the frequency. So I set those based on the desired protocol. You want to set up your patient, make sure they're in as comfortable a position as possible. So I just I'm going to put an energy. So I'm hurt myself at, let's say, 0.05 millijoules per millimeter squared. I'm going to leave the frequency at 7. That pre-adjusts when I change the intensity, and it defaults to 1000. I've got it at 1500, so I'm going to bring that down to 1000 shocks. I'm going to leave it there. Then on the patient's condition that I'm treating, I use an amount of gel to make sure I cover the surface area of the applicator tip that I'm using, right? So I probably want to use a little bit more if I was using this guy, but this one right here, right, is much smaller. So this applicator is the larger, longer standoff. So I'm going to use this for things that are more superficial, medium, and then I take them off and don't use anything if I'm looking to treat something a little bit deeper. So I've set my parameter adjustments and I'm ready to go. All I do is I hit the start button up here and it starts counting. You can hear these little clicks. The greater the intensity, the louder the clicks are actually going to be. Now, you don't have to move it around because it's not like therapeutic ultrasound. So we don't need to move it around. In fact, we typically want to keep it fairly stationary. Some people will move it around and try to find the area of greatest discomfort on the patient. Be careful with that, because sometimes you may hit something that just is simply more sensitive and not really the area. But we're not being destructive, so we're not overly concerned with that to any great extent. So just in that time frame, I already delivered 300 impulses, but we'll stop for the sake of time. When we're done, we clean off the equipment, disinfect it based on your policies and procedures, making sure that we're ready for the next patient. And then we clean off the patient and we're good to go. And we'll do the next level of treatment, based on your protocols and conditions that you're treating. So be sure to check out ChattanoogaRehab.com for more information on the product or other products. Certainly reach out to a distributor if you already have one that you're working with. Otherwise, you can also give us a call at 1-800-592-7300.
29. Thank you.